Are you waking up every night, desperate to pee but barely able to go? You're not alone. Millions of men face this silent struggle. The fear, the frustration, the exhaustion. It's real, and it can take over your life. But what if there were real solutions? Proven treatments that could give you back your comfort, your sleep, and your confidence? This is Urology. This is your health. And it's time to take control. Let's break the silence and discover the real options together. Because you don't have to live with these symptoms forever. Modern medicine has developed several procedures to treat an enlarged prostate and give men back their comfort and independence. Today, I want to walk you through 3 of the most important and widely used treatments: GreenLight Laser Vaporization, the stapling or Prostatic Urethral Lift procedure, and a newer technique called Prostatic Artery Embolization. Each of these has a different approach, with unique benefits and potential downsides. Let's begin with the GreenLight laser treatment, sometimes called laser vaporization. Imagine your urinary passageway like a tunnel that's slowly being blocked by thick walls of tissue. The GreenLight procedure is like sending in a high-powered laser to carefully burn away that extra tissue, clearing the path so urine can flow freely again. Doctors guide a tiny telescope through the urethra, the natural opening where urine passes, and then use focused laser energy to vaporize the obstructing prostate tissue. The advantages? For many men, this gives almost immediate relief. The urine stream improves, the constant urge to go lessens, and the bladder finally feels like it's emptying. It's minimally invasive in the sense that there's no large incision. The work is done entirely from the inside. But there are also challenges. Because the laser burns tissue, there's a chance of temporary discomfort or irritation. Some patients need to use a catheter for a few days afterwards because the urethra becomes swollen and inflamed. Some patients need to use a catheter for a few days afterwards because the urethra becomes swollen and inflamed. And perhaps the biggest downside is that the prostate can sometimes grow back over the years, meaning symptoms may return. Even with these risks, the GreenLight laser remains one of the most popular options worldwide because of its speed and effectiveness. Next, let's look at the stapling procedure, also known as the Prostatic Urethral Lift. This method takes a very different approach. Instead of removing tissue, the goal here is to simply move it out of the way. Surgeons place tiny permanent staples through the enlarged prostate tissue, pulling it aside and holding it open, like using curtain hooks to pull heavy fabric back and let more light into a room. Immediately, the urethral passage widens, and urine can flow more easily. The benefits are clear. There's no cutting or vaporizing of tissue, so recovery can be faster and with fewer complications. Many men like the idea that this procedure is mechanical rather than destructive, and they often feel improvement right away. But just like curtains can sag again, the prostate tissue can continue to enlarge over time. Staples may eventually lose their hold, or the prostate may keep growing, which means some patients need further treatment years down the road. Still, for men who want a quick, minimally invasive fix, the stapling procedure can be a very appealing option. The important thing to remember is that living with an enlarged prostate doesn't have to be your fate. These procedures represent hope, freedom, and the chance to regain control over your daily life. And now we come to the most modern and exciting approach, Prostatic Artery Embolization, or PE. The doctor makes a very small incision, usually in the groin or wrist, and guides a catheter through the arteries until reaching those that supply blood to the prostate. Through this catheter, the doctor releases microscopic beads that block the blood flow. What makes PAE so remarkable is how minimally invasive it is. And now we come to the most modern and exciting approach, Prostatic Artery Embolization, or PAE. The idea is elegant. The doctor makes a very small incision, usually in the groin or wrist, and guides a catheter through the arteries until reaching those that supply blood to the prostate. Through this catheter, the doctor releases microscopic beads that block the blood flow. With less blood reaching it, the prostate begins to shrink over the weeks that follow. As it shrinks, the urethra naturally opens up again and urinary symptoms fade. What makes PAE so remarkable is how minimally invasive it is. There is no cutting, no burning, and no hardware left behind in the body. Patients often experience less discomfort compared to traditional procedures, and recovery can be smoother. The trade-off is that results may take longer to fully appear, since the prostate has to shrink gradually. It also requires a highly skilled interventional radiologist to perform, and not every hospital offers this advanced technique. But for many men, especially those who prefer to avoid surgery or who have health conditions that make surgery risky, PAE can be life-changing. Results can be gradual. Still, for many men, especially those who prefer to avoid surgery, PAE offers a compelling option. It can help men return to hobbies and daily life with less discomfort. So how do these three methods compare? GreenLight laser is like carving a new path by removing excess material. The stapling procedure is like pulling obstacles aside and holding them back. And PAE works by starving the prostate at its source, shrinking it from within. Which option is best depends on each man's personal health, the size of his prostate, his tolerance for risk, and how quickly he wants results. Some men value immediate improvement, even if they might need a second procedure in the future. Others prefer a slower, more gradual fix if it means avoiding the discomfort of surgery altogether. The important thing to remember is that living with an enlarged prostate doesn't have to be your fate. If you or someone you know struggles with urinary symptoms, talk to a urologist or an interventional radiologist. Ask about these options and which one might fit your situation best. Medicine today gives us choices our fathers and grandfathers never had. From laser precision to mechanical lifting to vascular shrinkage, each procedure is a step toward a more comfortable, independent life. And every year, technology continues to advance, making these treatments safer, easier, and more effective. So here's the takeaway. If you're tired of waking up multiple times a night, if you're worried about kidney health, or if you've simply accepted urinary problems as part of aging, know that you don't have to suffer in silence. So here's the takeaway. Relief is possible. With the right treatment, you can not only improve your health, but also your confidence, your relationships, and your quality of life. Thank you for watching. If you found this video helpful, please give it a like, subscribe for more health insights, and don't forget to click the notification bell so you never miss our updates. And I'd love to hear from you in the comments. Which of these three procedures surprised you the most? And which one would you consider if you had to make the choice? Your comment could inspire someone else who is looking for answers right now. Here's imaging of beads lodging in the prostatic arteries during the procedure. Many patients resume activities like cycling and walking with their partners after recovery. Find a friendly clinic that offers these options and ask questions during consults. Overview: laser, stapling, and PAE. Compare the benefits, risks, and recovery timelines with your doctor. There's hope and increasingly effective options for comfortable, independent living. Watch more videos and check the resources linked below for more information.